We know some good things for people with osteoarthritis are mild forms of exercise, aerobic exercise, namely things like Tai Chi and yoga and aquatic exercise. Also, natural supplements, right? Things like curcumin, boswellia serrata. Top options really are unddenatured type 2 collagen, omega-3s. On top of that, things like green lip mussel, black cumin, methylsulfonylmethane, pycnogenol. They've all been studied. A low-calorie ketogenic diet seems to be a good thing as well. But did you know that chiropractic treatment can improve your prognosis with osteoarthritis? So can it actually help somebody with osteoarthritis? That's the question we had. That's a great question, right? Because in osteoarthritis, we have the degeneration of the cartilage between the bones. When it happens in the spine, we call that degenerative disc disease. Those cushions between the bones wear away. The body starts to add more bone down, make more bone to stabilize the joint. And what happens is eventually that can cause stenosis, which is narrowing because there's extra bone there, and now it's pressing on the nerves and causing things like pain radiating into the arms or into the legs, depending on where it is happening in the spine. But recently they did a trial on a bunch of rabbits, and they used an activator. So that's this gun that you can do an adjustment with. I typically use the hands for about everything, but to each chiropractor their own. This is one style of doing it. And it does put motion into the joint. It's very specific. There are some pretty good outcomes with it. Nonetheless, they use that. So they use a manually assisted instrument to adjust all these different joints in these rabbits that had osteoarthritis. They did that or a sham treatment where they barely touched the bone. They didn't really touch it. It shouldn't have any effect, right? And what they assessed was their levels of subchondral bone sclerosis. So what the hell does that mean? Subchondral, it's under the cartilage, bone. Sclerosis is hardening, right? And so you get hardening of that bone under the cartilage. And often this happens in OA to compensate for that lack of stability once you lose the cartilage, okay, from wear and tear over time. Albeit inflammation, it's always been known as a non-inflammatory arthritis. Inflammation may be a major contributor in OA. They're actually finding now, very recently as well. I think they're going to find that inflammation's related to pretty much every chronic disease. That's a whole nother topic. So they measured anyway their subchondral bone sclerosis, the integrity of the synovium, the synovitis. So that's inflammation of that synovium that surrounds the joint, right? It's just inside the fibrous capsule, the joint capsule, just inside of the bursa, which is just inside of ligaments, right? And then you have muscles on the outside of that and tendons running, above and below it type thing. So that's what the synovium is, kind of encases, it's this tissue, unique tissue, encasing that joint, right? Picture going from both sides of the knee joint. So they tested the integrity of that and the cartilage itself. And they found that the chiropractic adjustments improved all three of these things. They improved subchondral bone sclerosis, improved synovial status, and improved cartilage. So pretty interesting, right? You hear chiropractic and a lot of people just think, okay, this is, they're cracking. It feels good to get cracked. Well, you do release good endorphins, does loosen the muscles that are attached to those spinal joints that were adjusted, right? It does help to reposition the spine, at least temporarily, in terms of reducing pressure on the nerves, right? It gets blood flow into the intervertebral discs. Now, I paused there when I said repositioning because what really does that for a longer period of time? Chiropractic biophysics. That's actually addressing the curvature of the spine. That's where you put somebody on a traction machine, two-way traction, things like that, right? But nonetheless, pretty interesting. Putting motion in the joint is a good thing. Putting motion in your joints is a good thing for just about everybody. And now, with osteoarthritis, we want to keep blood flow. We want to deliver oxygen and nutrition and reduce inflammation in those joints, right? And so that we can help to preserve them as long as we can. Now, it wouldn't hurt, again, to have some anti-inflammatory stuff from fish and leafy greens. We talked about curcumin and omega-3s. Those are huge anti-inflammatories that also help to reduce joint pain and improve joint mobility in people with knee osteoarthritis. At least, most studies have examined it, but arthritis happens, throughout the entire body. but it's just a simple concept that makes sense. If you reduce inflammation, that's pretty much always going to be a good thing. If you're moving a lot, well, movement is medicine, right? And so long as you're not moving in a malposition all the time, right? If I'm a marathon runner and I have good form, right, then I'm actually going to slow down the degeneration of my cartilage. Marathon runners have half the rate of knee arthritis as non-runners. But then you look at people that run like this, right? Well, maybe this knee is and hip having some abnormal stress, right? So, hey, you did that all the time, it wouldn't be a good thing. But for the most part, guys, movement is medicine. Remember that. Chiropractic can help to ameliorate the symptoms of osteoarthritis and mitigate its progression. That's our message today. We got a birthday up in here. It's Jordan Smith's birthday. Happy birthday, man. This one's for you. Ready? Happy birthday to you. Happy birthday to you. Happy birthday, dear Jordan Smith, a crazy bastard on the rugby field, absolute beast that I respect, and now a family man. Happy birthday to you, and many more, man. Happy birthday. I hope you enjoy it with the newest member of the family. Say what's up to Jenna. How you doing, girl? What's going on? Who do we got on here? Say hi to my friends. Ma, what's up? I love you. You're great. Yes. Little Cakey, D. Cordova. Yeah, isn't that cool? Yeah, and chiropractic reduces inflammation in itself. Chiropractic's also been shown to help preserve bone density in people with osteoporosis. Preserve bone integrity. Protect the bone. Pretty interesting, right? It's great stuff. Cruxio, what's up? Chris Presco, hey, how you doing? Thanks for coming on. Louise, Hotson's 89, what's up, Malcolm? My man. Yes. Mr. Dave, that's right. He's the beast from the east, and he's up in the gym right now. Go get it. Get it, killer. I got it this morning. And App State Jag. Hey, App State Jag, nice to see you on here again. I feel like I've definitely seen you before. As for now. So we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks a lot. Happy One Wellness, you guys. Happy today. It's a beautiful day. Go enjoy it. Go do some movement.